Hi, I'm Devin with Medikit Health, and welcome to this installment of the Medikit Minute, where we're looking for feedback and thoughts on today's topic, which is a continuation from last week about front-end revenue cycle processes that lead to poor revenue cycle management and what you can do to remedy these problems. Today, we are on tip number 2, checking benefits eligibility and verification first. It is imperative to have someone in your office figuring out eligibility and coordinating that information. There must be policies in place that are spelled out to the T for staff to follow, and for your staff to be able to explain this information in a polite and clear way to patients. Going one step further, it is essential that you check their benefits and eligibility each and every time for their visits. Many times they're not being checked each time. Verbally asking the patient if anything changed doesn't count because they don't always understand their benefits or plan or have forgotten something since their last visit. Things that can change since their last visit might be their address, their type of plan, or eligibility. Your front office staff needs to get the most up-to-date insurance card at each visit. I'll be sharing my other 3 tips in my upcoming videos. In the meantime, I'd love to hear any challenges or solutions that you found with your front-end revenue cycle management. Have a good one.